here in the United States, we have more than 1 million people a day who cross our borders or enter our country through our airports. So the notion that we can just be focused on disease outbreaks within our own borders is pretty delusional, frankly, and we learned quickly that those who called early on for borders to be closed really didn't understand how internationally necessary it is for people in commerce to come in and out of this country on a regular basis, and what a dramatic and devastating effect that would have to try and shut ourselves off from the rest of the world. But that's not only true with health, it's also true in an area like food safety. We're dealing in an increasingly global marketplace for our food and for our medicines. In fact, we're now in a situation where half of the fruit that you buy in a grocery store each and every day, and about 3/4 of the seafood that you eat in our restaurants come from outside of our borders, and those numbers are growing each and every day, which means that we need a different kind of food safety system than we've had in the 20th century, because we have a very different kind of food market than we've had. We ran into some problems recently with some of our medical safety. Many of you may have seen that there was a recent scare with a drug called heparin, which is widely used in the United States. And suddenly we began to get reports of people reacting badly to the medicine, and some even were dying. And the FDA scientists, the Food and Drug Administration, which is another agency under the HHS umbrella, quickly identified that there was a contaminant in the medicine, and further they identified that it wasn't a normal byproduct. It had to have been specifically inserted into the products. And we knew then that it had to come from China, because all of the early ingredients for the makings of heparin are made in China, and so the only way that this ingredient would have been added. So it caused a conversation to take place with our Chinese counterparts, who were as eager as we were, frankly, to track down what was going on, because it jeopardized a very important pharmaceutical stream. And even though that conversation was a bit difficult at first, it has created a number of even stronger partnerships, where we now have FDA offices in 4 different cities in China and an expanding footprint. We are working in great collaboration with the Chinese, who have upgraded their food and drug safety systems and are eager to assure not only the United States but the rest of the world that the products coming from China are safe and secure. And that kind of collaboration on into the future will be very important for not only consumer safety, but to make sure that we're doing a responsible job. We can't any longer rely on just inspections here in the United States, or a food safety system that is based on a 20th century marketplace. So there are safety and health reasons, certainly, to be collaborative in an international world. But the second reason really to be involved and engaged in a department like Health and Human Services is that, frankly, we have a lot to offer. And there are a lot of countries very eager for that expertise. We've become in America experts in monitoring disease, in surveillance systems, in building laboratories, in training health workers, and planning and responding to pandemics. We lead the world in a lot of biomedical research, in cutting-edge medical technologies and countermeasures, and the ability to keep food and medicine safe. So all of those skill sets are eagerly sought by developing nations, by a lot of developed countries, by a lot of partners across the globe. Our experience, our research, our ability to help people train in their own countries. So one of the roles that Health and Human Services plays on a regular basis is doing that training in countries around the world. We're working now in dozens of areas, working closely with other governmental agencies, NGOs like the Red Cross, the Gates Foundation, the Global Fund, and CARE, universities, not only here in the United States, but foreign universities, and many, many foreign governments to help build healthier, stable societies across the globe. And what we're learning is that for these relationships to be really effective, they really need to be partnerships. We can't just work side by side. We absolutely have to work hand in hand. We need to stop thinking about how to maximize our own resources and how to leverage our assets in conjunction with other governments and other agencies. Part of that lesson is internal here in the United States, to take a whole government approach to the issues that face us, and that's certainly been something that President Obama feels very strongly about, that we really leverage our assets. You heard Matt describe some of the partnership initiatives underway, but those are going on day in and day out, where multiple cabinet agencies are sitting together at a table to solve problems. We work very closely with everybody from USAID and the State Department to our partners in Homeland Security and others to solve problems and accomplish common goals. One of those examples underway right now is the President's new Global Health Initiative. It was announced last May as an historic 6-year, $63 billion investment that is led by the State Department, USAID, and the Department of Health and Human Services. And it really fits into kind of the soft diplomacy of health services. In fact, the Health and Human Services can be very active and involved in lots of countries where the official diplomatic relationships may be a bit strained, but the health relationships are not. And our ability to really spend some time winning hearts and minds of neighbors across the globe can be enormously effective in terms of building new allies for America.